Distinguished guests, honorable speakers, ladies and gentlemen, good afternoon. I'm delighted to welcome you on the 6th plenary session about environmental health and urban sustainability. The session will be chaired by Dr. Franz Gatzweiler, Director of International Council for Science. Please give a warm welcome to Dr. Franz Gatzweiler. I would like to call upon the panelists of this session to take their reserved seats on the stage. On this occasion, it is my pleasure to invite Professor Yongguan, Professor of Soil and Environmental Sciences and Environmental Biology, Chinese Academy of Sciences in Beijing, and Director General of Institute of Urban Environment in Xiamen, China. Please give a warm welcome to Professor Yongguan. Dr. Sotiris Vardoulakis, Research Director of the Institute of Occupational Medicine in Edinburgh and an Honorary Senior Lecturer at the London School of Hygiene and Tropical Medicine in the United Kingdom. Please give a warm welcome to Dr. Sotiris Vardoulakis. Professor Lidia Morawska, Director of the International Laboratory for Air Quality and Health at Queensland University of Technology in Brisbane, Australia. Please give a warm welcome to Professor Lidia Morawska. And I was informed that we are still waiting on our last speaker, so Dr. Eugenie Birch, so I'm giving the voice to the chair, and if Dr. Eugenie Birch appeared, then we can introduce her. Yes? Please, I wish you a productive session.
Okay, thank you very much for the nice introduction. First of all, I am not the director of the International Council for Science. I'm directing a program of the International Council for Science.
So I was informed. But I promoted, yeah?
Thank you. Yeah. And now that you know who the speakers are, I also do not have to repeat that, but I would like to shortly tell you a little bit of what they are doing. So Professor Yongguan obtained his PhD at Imperial College in London, and he's currently the editor of various journals, among them Environmental Technology and Innovation, Environment International, and various other journals. He's a scientific committee member of the ISUH program on urban health and well-being in the changing urban environment, and he served for 9 years as a member of the Standing Advisory Group for Nuclear Application of the International Atomic Energy Agency. He received a lot of awards and prizes, which we do not have time to list here, but just to mention that he was selected as a Web of Science Highly Cited Researchers in 2016. So welcome again, Professor Zhu. Sotiris is a co-chair of the International Consortium for Urban Environment and Health and Sustainability called Healthy Polis, and has been health sector champion and one of the main authors of the first national UK climate change risk assessment and key contributor to the UK National Adaptation Programme. So welcome again, Sotiris. Finally, on the panel we have Lidia. Lidia is a co-director of the Australia-China Centre for Air Quality Science Management. I just mentioned that because we have here the China connection. Her research focus is on science of the airborne particulate matter, especially ultrafine and nanoparticles. She's a fellow of the International Atomic Energy Agency as well, and has been acting as an advisor to the World Health Organization, as well as being a past president of the International Society of Indoor Air Quality and Climate. And even though Eugenie Birch is not here now, I would like to shortly introduce her. She might come in towards the end of the session. Eugenie Birch holds the Nussdorf Professorship for Urban Research, School of Design at the University of Pennsylvania. She is founding director of Penn Institute for Urban Research and co-editor of Penn Press, The City in the 21st Century series. She has served as a member of the New York City Planning Commission and is on the jury to select the designers for the World Trade Center site. She has also served as a co-chair for UN Habitat World Urban Campaign and is President General of the General Assembly of Partners and member to the US delegation to Habitat 3. I would now like to ask Yongguan to start with his presentation, and the other panel members, you are free to go back and watch the presentation from your seat. We have until 12 o'clock, so the presentations will be around 20 minutes. We will and save your questions for each of the presentations until the end. Thank you. Yongguan, the floor is yours.
Thank you. Thank you, Franz, for your nice introduction, and also I would like to thank the organizer for inviting me, and this is a great experience to interact with participants with really interdisciplinary background. So today I'm going to talk about something invisible, which I have been researched over the years, the microbes. The microbes in the environment, they are invisible, yet they transport with no boundary. So when we travel all the way to Coimbra, we also bring the microbes from our background environment to this new location. And there are implications for the environment and the health of the human being. So with urbanization, we know that there is a great or big reduction or decrease in human nature contacts. So nature contacts is typically limited in the cities when we move from the rural background to the cities. And the urban population, it has been surveyed, and it estimated that urban populations from developed world spend more than 90% of our time indoors. So cut the connectivity with the nature. For example, park visitation, hunting, fishing, camping, etc. All these outdoor activities have all declined substantially over recent decades. And what I'm very interested in is the urban green space and the microbiome. As we see the urban green space, we see the trees, we see the color, and we also see the impact of this green space on, for example, temperature, to cool down the urban heat islands. But normally, with our naked eyes, we don't see the microbes. There are already some studies showing that the urban microbial diversity can be surprisingly strongly related to some of the health outcomes of urban population. For example, our immune system. Our immune system can be boosted by some particular microbes in the environment. And as we are moving to the cities and moving to the indoor environment, we are losing some of our old friends. And these old friends, they can boost our immune responses. So I think this urban microbiomes research is really emerging as a topic of great interest to the general public, but also to scientists. So I think with urbanization, there is an issue of imbalance. As I said, every human body, we carry, some estimations show that we carry 10 times more microbial cells than our own cells. So we have two genomes. One is our own genome, and the other is a microbial genome. And we live together happily most of the time, every day. And some conservative estimate, at least there's an equal number of microbial cells in our human body. So when we move from the rural area to concentrated urban environment, there is an imbalance between our human microbiome as relation to the environmental microbiome. So the ratio changes, and I will show you some results from our own laboratory later on. So humans are discharging microbes every day, and this is just one estimation I published a couple of weeks ago in Science. We talk about the microbial mass movements with the modern society. So we discharge an awful lot of wastewater. We transport our goods globally. We import, export meat or cereal products, and these products all carry microbes. And the ballast water in the ocean transport, they transport a large volume of microbial cells, and they discharge at the destination, and in many cases, this will cause environmental concern or even environmental damages. Here I just illustrate one example, that is the clinical class 1 integron, which we consider is totally originated from human activities. We use antibiotics nowadays as a selection pressure induce these genetic elements to evolve and to spread. And these genetic elements can recruit alien genes from the environment, and they can shuffle the gene to nearby microbes. So this is so-called horizontal gene transfer. So here we are talking about the movement of the microbial cells themselves, but also the genetic information that can be transported between microbial cells. So when we discharge wastewater, we also discharge a lot of chemicals, and these chemicals are selective pressure for the microbia to survive and to thrive. They have to acquire new genes at a new location. And this is a kind of issue we are considered and we are concerned in our research. And I think this is a new dimension of urban health. So this diagram just demonstrates we conducted a nationwide survey of how much microbes we discharge every day. So we sampled in many, over 100 wastewater treatment plants across China. And we sampled every morning. So this amount representing the collective human gut microbiome. So by using genomic tools and molecular tools, we can characterize or quantify some of these genes. For example, here we talk about these antibiotic resistance genes. So we calculated that on average we discharge 10 to the 13th copies of this gene every day, per person. And we calculate on the population basis, and you can see in the eastern part of China with the hot color, that means much more copies of these genes are discharged into the environment. We are flushing these genes into our toilet and then channeled to the wastewater treatment plant. And the wastewater treatment plant is a biological reactor. So lots of genetic elements are being exchanged there. And some of the microbes eventually discharged into the environment, and they can be accumulated, they can proliferate under some conditions. So this just gives you a big picture of what we are discharging, these invisible contaminants to the environment from the cities. And these two pictures just to show you how the wastewater treatment system is dealing with these genetic elements. And you can see that from this side, there's almost like each bacteria cell we discharge every morning, there's about 6 copies of antibiotic resistant genes. And you can imagine if we multiply the number of people, the number of bacterial cells we discharge, it's astronomical number of these genes being discharged. And luckily, through the wastewater treatment system, there is a great reduction in these gene copy numbers. However, if you look at this, still like 2 copies per bacterial cell. And as a background value, I would like to say is only 0.01 copies per bacterial cell in the pristine environment. So no matter how we treat the wastewater, we are still discharging these genes into the environment. And this is a concern and need more attention for research. So when the water is discharged, whether it is raw wastewater or it is reclaimed wastewater, there's still the accumulation of these resistance genes. So we sampled many cities in China, and we particularly focus on the urban parklands that have been irrigated by reclaimed wastewater. And you can see from the next diagram, after a few years of irrigation with wastewater or reclaimed wastewater, you can see the elevation, the enriched antibiotic resistance as compared to the background value. So sometimes it enriched 10-folds, even more, of these resistant genes. So clearly, there is a risk of these resistance genes being enriched in the environment. I'm not saying there is an immediate risk, but certainly there is a concern, and we should consider when we discharge the wastewater or reclaim the wastewater. As I said, in the developed world, we spend more than 90% of our time indoor. So the indoor environment is also very important, and the indoor microbiome indeed is influencing our health through a number of ways. This is just a featured article in Science a few years back. And I just want to show you a very recent study from my laboratory. I sampled over 200 homes in Beijing. And I sampled the windshield dust in each home. And we extracted the microbial DNA. And we sent this DNA for sequencing. And you can see there is some special patterns of the microbial community in these homes. And I believe when we look at this distribution, together with the green space, together with the water consumption or the indoor ornamental plants or pets in the homes, they're all very well connected. So we are influencing the microbial community not only in the general environment, but also in the indoor environment. And these microbes, some of them are good, some of them are bad, and we have to understand them, and we have to harness them to improve the proportion of these beneficial microbes. And we should try to inhibit the human pathogens in the home environment. So what systems approach, why systems approach is important, you probably know. Microbes, they are everywhere. They're everywhere. And the microbial world is invisible. We can't see them. Not like trees or animals we can see. But the microbial world, we need modern technology, particularly with the advent of molecular and genomic tools. Now we are able to visualize this microbial world by looking at the DNA and the DNA sequencing and the genetic information. And as I said earlier, microbes, they move with no boundary. So we have board control, passport control for humans, for goods products. However, we have little to do in controlling the movement of microbes. So this is really a challenge. So some considerations. I just want to illustrate these snapshots of what we are doing in the laboratory. And some considerations for future studies. I think systems approach is really important because this is a complex system. Ecosystem, transport, pollution, social network, they all will affect the microbial world. So there are multiple interactions for human health. And epidemiology, how can we understand the linkage between the urban microbiome and the human health? So this is really complex. So not to say the complexity of the microbial world itself, but to link the composition of the microbial world with human health outcome is a daunting task. And fortunately, new tools are emerging that we can use these tools to dissect the relationship. And also, we need the assessment tools for the risk and risk prediction and communication. So far, I talked about particularly the antibiotic resistance, but we have little information in terms of predicting the movement quantitatively so that we can see the breakout of these resistant genes in the environment. And I propose that there should be a fusion of two data sets. One is the genomic data sets, which is enormous. We using the sequencing facilities now, we can do human genome sequencing, microbial genome sequencing very quickly and affordably. But there's a big database. How can we link that to the traditional biogeochemical database? The physical characteristics of the environment, the chemicals, release of chemicals. And if we can fuse these two data sets, probably in the end we can predict the movement of the microbes and the movement of some of these particular genes, such as the antibiotic resistant genes. And we should look at the modulation, how can we harness the microbial world, for example, the green infrastructure, urban design, both outdoor and indoor urban design. And of course, pollution control is very important because the pollutants, they pose a selective pressure on the microbial world, and they will induce the emergence and the spread of resistant genes in the environment, and eventually come back to the clinical, to the human indoor environment, and threatening our health every day. So just want to wrap up. How can we effectively and rapidly monitor the microbial world, which is very important? We should develop robust monitoring tools, particularly those we can apply in the field. So nowadays we can even have a portable DNA sequencer in the field. We can take sample and doing the sequencing in the field. So these are very powerful. And then we have to think about how to predict their spread in the environment. And I already mentioned the fusion of these two data sets, genomics and environmental data sets. And how can we disentangle the complex relationship between the diversity, abundance of microbes and human health. So the microbial epidemiology, I think, is the area that we can work together to understand the human health outcome, and how to develop practical measures to harness the microbial world for human health. For example, how can we eliminate the antibiotic resistant genes from wastewater or from animal manure, because these are all resources. So we should eliminate these hazards before they are applied to the field for food production. So this is really a food environment and nexus that we should address. So here just some concluding remarks. I want to wrap up. I think that a holistic view of environmental health is needed. We look at the healthcare, food, water, air, landscape, and also sustainable mobility. And the microbial world is the overlooked determinants of urban health. I would like to propose and want to promote this area of research, because really this has been overlooked. And future science efforts should directed to understanding the dynamics of the microbes in the urban environment and their impacts on human health and well-being. And environmental health knowledge related to microbes should be translated into practice policies, and this policy implementation should be monitored. So for example, the urban design, the indoor and outdoor, if we learn more about how urban design affected the microbial world, we can certainly improve the design and to maximize the beneficial effect of the microbial world. And with that, I want to conclude, and I want to thank you for your attention. This is my institute, Institute of Urban Environment, under the Chinese Academy of Sciences. Thank you very much.
Thank you very much, Yongguan, for this excellent presentation. In the meantime, we have received news that our last speaker cannot make it to our session. So for the next speakers, please take the time you have. And I ask Sotiris Vardoulakis as the next speaker on the floor, please. Keep your questions until the end of the session. We will switch on the lights again and have a discussion round.
Very good presentation, and there's such link is very much to what I'm going to say.
Thank you very much. Thanks very much, Franz, for the introductions, and thanks everybody for staying up to the end of this very fascinating conference here in Coimbra. So I'm Sotiris Vardoulakis, and I work for the Institute of Occupational Medicine in Scotland. And as Franz mentioned, I also co-chair the Healthy Policy International Consortium for Urban Environmental Health and Sustainability. And I'm gonna talk about the work we're doing at the Institute and some collaborations we have, and reflect more broadly on the presentations we've seen over the week here in Coimbra, and provide some thoughts about future work and about the network we're building through Healthy Policy around urban health and sustainability. So I would like to start my presentation showing you this amazing picture of the Rio Montego. This is the view I see every morning as I walk from my hotel. I stay at the other side of the river, and I walk down the hill from the old university. I see the river, the place of the conference, which is here on the top, and I can hear the birds and the noise of the river. And I feel, this is amazing for my personal health and well-being. But I would like also to reflect a little bit about urban health and how that kind of environment can promote health and sustainability more broadly in an urban environment. So in the way back from here back to my hotel, I have to climb up the hill of the old university. My hotel is on the back side. And as I walk up, my heart rate goes up, and I burn some calories, and I feel energized. And I also wear this mobile, this smart watch, which counts my steps, the miles, the calories, my heart rate, and everything, and communicates with my mobile phone and collects a lot of data. So when I go back, as you can see here, I have a number of options. So I can walk 1.8 kilometers all the way back to my hotel, or I can take the long route by car, drive 5 kilometers or 3.5 kilometers, emit some air pollution, some carbon dioxide, and sit in a car for 10 or 15 minutes. And I can tell you which is better for you and for your health when we have to make these kind of choices. So connected to my to my smartwatch, I can look at my objectives for the day. I can see how much I have walked and the calories burned. And my watch tells me that this could be my best week ever, which means that I can hit all my objectives just by walking back and forth to the conference venue and up and down the hill. And I think that's amazing for urban sustainability, for environmental sustainability. I can tell you it's very good for my personal sustainability. And it also makes me reflect about data and all the data we collect on a daily basis on smartphones, on wearable devices, credit cards, etc., and how we can harness this kind of big data as we try to improve urban environments and our health. Now, moving from Coimbra to the rest of the world, to the global picture here, You can see the cities and how they have evolved in the world with mega cities, the red dots, and large cities and medium-sized cities. You see the concentrations in the Far East, China, Europe, North America, etc., and growing cities in West Africa and Latin America. So obviously, we discussed extensively during the conference how the population has grown in many parts of the world. And I think most importantly, you can see here the third line, the gray line, which shows the increasing population in urban population in upper and middle income countries, which includes many of the countries in East Asia. And of course, this puts a lot of pressure on resources and also exposes us to a range of environmental hazards in urban areas, including air pollution, road accidents, traffic, floods, heat waves, and also the effects of the lack of urban green space. So there are many challenges, many hazards. Some of these challenges are related to climate change, increased urbanization, but also related to the aging population and the changes in patterns of employment. So we work from home, we commute long distances, and this puts strain in our health and in our environment. Having said that, there are substantial opportunities to harness the low carbon transition in cities, living in compact cities, which help consume energy in a more efficient way and connect and have access to service, education, healthcare, etc. So there are a number of large opportunities, substantial opportunities related to urban living. And of course, we have the big data, the citizen science technique involving citizens in doing science, integrating assessment methods, and the whole concept of sustainable development, which can help improve our lives and the urban environments we live in. As Franz mentioned, I was involved in the UK National Climate Change Risk Assessment and the National Adaptation Programme. And that was one of the infographics we had after the publication of the report earlier this year, which had the focus on cities, and that was one of the key chapters of the report. And a lot of our attention was on how we can adapt to climate change obviously, but in a way that makes cities more sustainable and help us transform these grey, congested, polluted cities into something which looks much more sustainable, healthier, and a really nicer place to live in. And it's very important to be able to harness this kind of sustainable development, this kind of adaptation to climate change to create a more livable and healthier environment. I have also listed here a number of, around the slide, a number of European projects or collaborations with China in which IOM has contributed to. And I will talk about a little bit about interventions and in cities, like how we can make cities more walkable and assess the impacts on health, benefits for health. Look at green walls, like this one in London, or cool roofs that help us reduce overheating in buildings and the urban heat island effect, and also the use, as I said, of smart devices and portable wearable equipment. Now, I will start reflecting a bit more about temperature effects and climate change and the potential impacts on human health. So you can see here this map of the temperature anomaly, as we call it, across the world. So this is deviation, this is the departure from a long-term average temperature. And basically what you see, whatever is above zero, it shows a warming of the climate system due to climate change. Over recent decades and compared to the long-term background. And you can see some parts of the world are warming more than others, in East Asia, North America, etc. But it's unequivocal. The warming is happening across the different regions of the world. And this is putting stress on people's particularly vulnerable populations, which are the most affected by extreme heat. This framework here, this diagram, shows you the concept of heat vulnerability. And I would like to reflect a little bit on how we're affected by heat. So what you can see here, obviously we have the external drivers, climate change, urbanization, population change. But the key factors that affect vulnerability to heat are our exposure to higher temperatures, our sensitivity, it's dependent on age, socioeconomic status, etc., and also the adaptive capacity of our households, of our neighborhoods, and of our cities, the adaptive capacity and how we can adapt to climate change and a warming environment. And you can see here that there are adaptation responses, which can be heat health warning systems, can be better design of cities, better design of buildings. So of course, we want to make sure that we act on all these factors that affect our vulnerability to heat and we minimize the risk. Talking of which, we're talking about risks. I would like to give you some results from a study we carried out a few years back, looking at the relative risk of heat mortality in the UK and Australia, in different parts of these countries, and reflecting a little bit on the differences between different regions. You see here different regions in the UK, and you will see that the relative risk of heat mortality in association with 1 degree increase of temperature above a threshold is higher in London than in other parts of the UK. So you can see here London sticking out. And we did the same for cities in Australia, and you will see that Brisbane, in Brisbane the risk is higher. So bad news for my family because who lives in London, and for Lidia as well. Sorry Lidia, in Brisbane you are at high risk of heat-related effects. And of course, we want to reflect on that and try to understand why certain populations, why certain urban areas are more affected at high risk of heat than others. And this could be related to the urban design, to the makeup of the population, and the urban heat island effect, and other factors, urban green space, etc. So what we did as part of this study was to use these relative risks to estimate the burden of heat on mortality in the UK and Australia over time, taking into account climate change. So taking into account climate projections under different emission scenarios. And what you see on the top are the estimated burdens for the UK, and the bottom are the estimated burdens for Australia. And on the left-hand side, you see the estimates if we assume that the population is constant, and on the right-hand side, if we assume that there is an increase in population change, aging populations. And you can see the pattern is very, very similar in all parts of, in both countries. So we have a steep increase from the baseline, which is the current baseline of heat-related mortality, and this mortality increases as we look into the future up to the end of the century. And when we look at if we take population projections into account, this increase is even steeper. So climate change is likely to increase heat-related mortality in many parts of the world, and especially, well, the results here talk about the UK and Australia. But I would like to point out that in this case, we use the relative risk you see in the previous graph. So we haven't taken into account any adaptation to higher temperature. So the relative risks are constant over time. And this might not be the case. So I will show you some results from a literature review carried out by my excellent PhD student, Kath Arbuthnot, at LSHTM. So Kath carried out a literature review, identified a number of studies which looked at the relative risk of heat mortality over time in different places. And she found that 10 out of 11 studies showed that there is actually a decrease in vulnerability to heat over time. It's a small decrease. You might not be able to see this in the graph, but it is statistically significant for 5 out of the 10 studies which are presented here. So our vulnerability to heat is decreasing, and this is probably because we're adapting to heat. The housing is becoming better in many countries, so we have more air conditioning, which is not necessarily the best way of adapting to heat. So I'm going to move on to another study about heat, and I will zoom down to one specific urban location. So this is Birmingham, in the UK. So this is the West Midland regions in the middle of the country. And in this case, we carried out a modeling study to look at the difference in heat vulnerability within an urban area. So we used a mesoscale meteorological model, WRF, to look at the temperature at surface level within the city. And you can see here the different urban landscape, the different urban terrain types which are used in the model. So by the way, this study was led by Helen McIntyre and Claire Heaviside from Public Health England and published recently in Stoughton. So we used this powerful modeling technique and tools to estimate the surface temperature, as I mentioned, during the two most well-known and important and impactful heat waves in Europe, the 2003 heat wave and the 2006 heat wave. And you can see here the urban temperatures in West Midlands. You can tell that the temperature higher where the population density is higher, in the middle of the modeling domain. And we were interested to look at the vulnerability to heat of different age groups and different housing types within the city. So what we've done here, we plotted the results in comparison to the mean temperature, the average temperature in the domain, and we looked at nighttime temperatures and daytime temperatures. So I don't have a pointer, but if you look at the left-hand side of the graphs, you'll see on the top that for different age groups, we see that the risk of being at higher temperatures, to be exposed at higher temperatures, is slightly higher for the population, for young professionals, for population groups around 20, 25, 30-year-old. And that is consistent with the nighttime exposure to higher temperatures. When we look at housing type, you will see that flats and terrace houses are exposed to higher temperatures than other housing types, like detached houses, which are usually not in the city center, but in surrounding areas. And that's consistent during nighttime and daytime. And on the right hand of the graph, you see that there is actually increased exposure to heat for the more deprived populations within the city, within the modeling domain, within Birmingham. We also looked at sensitive locations. We looked at the location of hospital and care homes within the modeling domain. And what you can see here is that most hospital and care homes were exposed at temperatures above average during daytime, and much above average during nighttime. So again, sensitive locations, people hospitalized and care homes are likely to be exposed in higher temperatures in West Midlands. And obviously here we are talking about outdoor temperatures, and one has to reflect how that might relate to indoor temperatures. And we had discussions with Lidia about this kind of relationships. Now I will change tack and talk about air pollution in the rest of my talk, and focus on particulate air pollution in different parts of the world. So I'll show you this map here, which illustrates that around 90% of the world's population is exposed to PM2.5 levels above the WHO guideline value of 10 microns per meter cube. And many areas which are heavily urbanized and densely populated, like in North America, Far East, China, North Europe, are exposed to high concentrations of PM2.5. So PM2.5 is the finer fraction of particulate matter, which is respirable and can go down, deep down in our respiratory system and cause inflammation and knock-on effects on health. So this is of great concern. And of course, that was one of the, PM2.5 was one of the indicators we looked at as part of the large EuroHealthy project that Professor Paolo Santana has coordinated here in Coimbra University. So the aim of this project, you can see here, was to look at policies that have the highest potential to enhance health and health equity across European regions with a special focus on metropolitan areas. And you can see here there were 14 other project partners, 2 from the UK, and we look at the number of urban settings, urban areas in Europe. And I won't have time, obviously, to discuss the results. We collected a large amount of environmental, socioeconomic, healthcare indicators. I will only talk about air pollution and some of the results that my colleague Christina Michakou presented in one of the sessions earlier. So what you can see here is PM2.5 concentrations in London, Stockholm, and Athens, and you can tell that there's quite substantial variability between the 3 cities in different parts of Europe, west, north, and south, with Athens being generally much more polluted. But you can also see quite a lot of variability within cities. So you can see variabilities from within London and Athens in particular. What we did was we used exposure response relations from a literature review to estimate the mortality attributable to PM2.5 in these 3 cities and within the cities. And as you can see here, the results show that a substantial amount of mortality, all-cause mortality, is attributable to air pollution. You can see that in London it's between 6 and 7%, going up to 8%. But it's much higher in Athens, especially in the center of the city. So a substantial percentage of all-cause mortality is attributable to particulate air pollution. And that's only part of the story, because there are other pollutants like nitrogen dioxide and ozone which have significant effects on health. As I said, we collected a large amount of data, including socioeconomic data, which are now in the process of being analyzed. But I would like to show you some results from London from a different study, which looked at particulate air pollution and the levels of deprivation within the city. And as you can see here, the exposure to air pollution is higher, slightly higher, for the more deprived groups of the population within London. So there's variability, and the difference is not very large, but there is some indication here. There is some signal of higher exposure level for the most deprived, and obviously that has significant implications for health equity and environmental justice. And if we plot the same kind of results, by the way, for other pollutants like nitrogen dioxide, which have a steeper spatial gradient within urban areas, then the results are more pronounced. I will move on. I will whiz through a number of studies we've been involved in starting from Citizens, the very inspirational study led by Alena Bartonova at the Norwegian Institute of Air Research and her colleagues, with many other institutions in Europe. I think around 30 institutions involved. So that was a citizen science project, creating citizen observatories for air quality across Europe. And that involved low-cost monitoring equipment. Some of the equipment was static there, lampposts in schools and nurseries and universities, but there was also portable wearable equipment and mobile applications and some web-based questionnaires. So the idea was to engage the citizens in understanding, monitoring air pollution and using the results to inform environmental policy. And you can see here the project collected a huge amount of data, 9.5 million observations within a couple of years. And I think that also raises questions about big data and how we process this data and how we can make the best use of this kind of information, which goes back to the earlier point I made with my mobile phone and smartwatch. We're leading on a number of other studies. I will mention this study in China on air pollution impacts on cardiovascular and respiratory disease in Beijing, led by the Institute of Occupational Medicine. We have 2 cohorts in Beijing, and we also carried out a study looking at the effectiveness of different face masks in removing particles and reducing personal exposure. We're also involved in a study on air pollution in New Delhi, in India, which focuses on pregnant women, newborn children, asthmatic adolescents. So it focuses on the most sensitive population groups within the city. And we've recently kicked off another study in Thailand on air pollution impact assessment, mainly looking at traffic-related pollution, but also pollution coming from agricultural burning. I will mention another study, European study in this case, which brings everything together, our exposure to the environment and also our unique genetic characteristics and our genome in trying to identify the risks for developing adverse health outcomes. So this is the HILS study on health and environmental-wide associations based on large population surveys led by Paris 6 University in France. And as you see, we use a number of techniques, internal dose modeling, human biomonitoring, bioinformatics to tease out these complex relationships between health, environment, genetics, and disease. There's a lot of discussion in the conference about complexity, and Franz is the guru for urban complexity in relation to health. But I would like to make a point here that we need to harness complexity in cities, and we shouldn't lose sight of potential interventions, quick wins in cities, which will help us improve health, which will help us improve the environment. And I listed here some local interventions on low emission zones, active travel, no idling zones in cities, and awareness raising campaigns, focusing on air pollution, but also providing additional health benefits related to improved physical activity levels and reduced greenhouse gas emissions. This link very strongly with the Sustainable Development Goals and the New Urban Agenda. We think that health has to be in the center of the New Urban Agenda, and of course very strongly linked to the cities and the environment. And I would like to mention, just in passing, the Global Challenges Research Fund in the UK, which funds UK researchers to work with developing countries in topics related to the Sustainable Development Goals. So if you are interested in working with UK institutions, with us, and trying to address sustainability issues in developing countries, please come and talk to me, or send me an email. And finally, I will close by just summarizing on Healthy Polis, the International Consortium for Urban Environmental Health Sustainability, which was formed a few years back and has as an aim to promote research innovation, facilitate international multidisciplinary research collaborations, provide training, and promote capacity building, and evaluate interventions. We have around 1,400 members from around 100 institutions and 30 countries around the world. So the consortium has grown very substantially over the years. There's a very strong focus on cities, climate, pollution and health and sustainability. And we're very keen to involve you. Please do contact me if you want to have more information about the workshop or become more involved in our activities. On Monday we run our 4th annual workshop here in Coimbra. We see here distinguished speakers. We are many of them in the room today. And we publish a number of special issues. Last year we published a special issue on challenges and opportunities for urban environmental health sustainability, and we are currently publishing another special issue on urban climate, air pollution and public health. And these are papers available open access, free of charge online. So please do go to the website and follow up the links there to download the papers. We have also blogs and newsletters, and as I said, please do contact me if you want to be added to our distribution list. So without further ado, I would like to thank again very much everybody for staying so late in the conference up to the end. And I would like to thank very much Paula, Joe, the Coimbra team, the Society of Urban Health, and Elsevier for organizing an amazing conference in an amazing place. Muito obrigado.
Good morning, everyone. Bom dia. I would like to start with thanking Paula Santana and her team from Coimbra for organizing a most wonderful conference and for giving me the opportunity to be part of the conference. Thank you very much. Muito obrigada. The title of my presentation, How Cities Can Save Us All. And you may wonder why the title and whether I have the answer to this. As I was putting thoughts together for this presentation, I was reading the recent issue of Scientific American, while the lead article is on memories. But if you see the circle up there, it's this exactly title, How Cities Can Save Us All. This is the issue in July 2017. So there's 4 articles, very interesting, dealing with waste, energy, and transport. Now, I'm not going to talk about these specific articles, but there's one message which runs across these articles, to which I will come back later. In my presentation, I'll touch upon several issues: healthy buildings, healthy cities, but also other types, smart, livable, and the many ways of ranking the cities. Complex system, I guess everybody was talking about complexity of the system, and the change coming in terms of technology and data, and whether this is enough. Now, you've got on the screen a list of terms appearing, and you may wonder what's this eclectic list of, in a way, of keywords. Now, these are all terms and topics and issues which are included in the World Health Organization guidelines on housing and health, which is in preparation. It's been for 3 years in making, and is in the final stage of review. Now, this is housing and health, but if you look at the terms on the screen, many of the terms are related not only to what's indoor in the housing, but strongly relate to outdoor, so immediate outdoor housing environment, noise, accessibility, heat, cold, which is influenced by the climate, ventilation, and so on. So we cannot really talk about healthy housing without talking about what's outside the housing, which means the relationship between house and its environment, urban environment. I will make 2 points about this, the importance of outdoor environment and what's related to this. Most of you would have seen this list, global burden of disease, and listing the 11 top risks humans are faced. Now, as you can see, at the number 11 is ambient PM 2.5. Before this is household air pollution, which is strongly linked to inside biomass burning. And most of the risks at the top are lifestyle risks of the developed societies. So, ambient PM 2.5, outdoor air. You may again ask the question, okay, first of all, how do we know this? And why is this? How do we know this? Because there were large databases available on outdoor air pollutants. Basically, every country and every state is monitoring outdoor air. These data were used for epidemiological studies, and studies show clear link between outdoor air pollution and health. So first of all, data allowed us to do this assessment, but secondly, it may be surprising that this is the outcome despite the fact that we spend most of the time inside. Another example is temperature. We've talked a lot of temperature, and Sotiris brought in this issue in his presentation. Now, we've got 2 graphs from the recent Lancet papers showing relative risk in 2 cities which I selected for this purpose, Madrid and in Stockholm. So on the horizontal axis, we've got temperature, and as you can see, in temperature in Madrid goes from below 0 to about 30, in Stockholm from minus 15 to over 25. And then you can see the shape of the exposure response relationship. They are different for both of the cities. But again, this is the impact of outdoor temperature on health, despite people spend most of the time inside. So we can not talk about healthy buildings without healthy cities, and vice versa, buildings are fabrics of the city. So I will now move a little bit towards this concept of healthy cities. There's been many projects and big programs conducted on healthy cities. For example, this one by the CIB, the International Council for Research and Innovation, and its task group 86, building healthy cities. I've been chairing this task force for the past 3 years. It's running towards the end of its term. It's a relatively small group, but I believe that there's been lots of useful activities conducted. Well, there's another healthy cities project mentioned by Carlos Dora during his plenary presentation. This is a WHO network of cities, 30 national networks, over 1,400 cities and towns, and it's got specific emphasis on inequity, vulnerable groups, participatory governance, and so on. So the idea is to bring these cities together and enable them to interact and to improve the city environment. But these are healthy cities. But as we've heard on numerous occasions during this conference, cities can be also smart, can be and should be sustainable, energy efficient, livable. So there are many ways at which we can look at cities. Yesterday, Billy talked in her presentation about livable cities. Most livable cities. I was preparing this presentation before the current ranking was announced, so now Melbourne is number 1 for the 17th time, for the 7th time in a row. And if you look at this list, so it's Melbourne, but there are other cities of Australia, Adelaide, Perth, there's also Auckland. So Australia features very prominently on this list. Billy also talked about the categories which were used, and broadly stability, healthcare, culture, environment, major culture and environment, education and infrastructure. All right, so we can now say perfectly we understand how to rank the cities and what's the best way to look at the cities. But this is not the only ranking. There is also Mercer Quality of Living Survey. You may not see very well from the distance this list, but the top 10 cities, none of the cities which were on the previous list feature here. There's only one Australian city, Sydney, at the very bottom, and in general the list is quite different. Now we've got the categories here, consumer goods, economic environment, housing, and so on, natural environment. So there is some similarity, but also differences between the rankings. Now, there's another way of looking at cities. The smartest cities. What are the world's smartest cities? Now the list looks very, very different. All Australian cities disappeared from this list. And as you can see, the American cities, New York, Boston, San Francisco, but also some European cities, feature on the smartest cities. You may now ask, okay, what is the basis for this? These are the broad categories included. Again, you can see similarities. It's difficult to just from a list like this to compare. I looked specifically what was included under environment in this ranking. CO2 emissions and index, methane emissions, access to water. Now there was also air quality, PM2.5, PM10, pollution index. So it is actually quite good to see that smart city in this context also mean healthy cities, because air quality is a health index. But the bottom line of this is, and that's what we've done as a part of this CIB group, we've looked at all these indicators used to rank the cities and city performance. So across these different rankings, and I didn't list here all the rankings which we found, international rankings, we found almost 250 indicators which are used for ranking the cities. Well, so basically it depends from each angle of view you look at the cities. And this is best viewed at this little, it's not an animation but close, so much depends on the point of view. If you look from this angle, we see a set of poles. From this angle as well, but from this angle, we see Nelson Mandela. So this is the current situation. We look differently at the cities. There's no doubt that we are dealing with an extremely complex system, and this is something coming across all the presentations through the whole conference, with multiplicity of interactions. And the questions, is it manageable? Well, it has to be manageable. So it's not a question whether is it, but it has to be manageable, and it's the only question is how and which way to go. So I will now go back to the healthy buildings to make a point which also has been coming through the conference. So we've seen this graph a little while before, looking at the temperature in Madrid and Stockholm. All right, you can see different curves, but if you think for a moment about this, is it a different breed of people living in Madrid and in Stockholm and responding to temperature differently? Why such a different exposure response curves? The reason, we believe, is that it was not indoor but only outdoor temperature taken into account in this assessment. And why? So the whole epidemiology which was done was based on outdoor temperature, while people are exposed to indoor temperature. And indoor temperature is not available. Now, in Madrid, which has a tropical, subtropical climate, at winter time when it gets warm, I believe most people don't heat up their houses, which means they are exposed to lower temperature. But in Stockholm, which has cold climate, when the temperature drops, outdoor temperature drops below a certain level, people start heating their houses and they are not exposed to this low temperature. So this is not really a real exposure to temperature response curves, but reflection only on the outdoor temperature. Now you may ask why or how this issue came up, because this is a very good paper published. So how do we know that indoor temperature data is not available? Now I mentioned a little while ago this WHO guideline on housing and heat, housing and health. And one of the chapters in this guideline is on indoor heat. And the question was, what should be the guideline value for the maximum indoor temperature? WHO, in its works, tries as much as possible to give numerical guideline values, if it's possible. So, being responsible for this chapter, first of all, we looked at the studies on exposure indoors and health effects indoors, and we basically didn't find any studies. So the next step, we decided to look at the studies of indoor temperature, and kind of taking an indirect approach to, in a sense, to correct this data of the outdoor. And what happened? Literatures of indoor and temperature, we found this thousands and thousands, tens of thousands of records, but literatures of indoor and outdoor full year temperature, 3 studies. Now, what are we talking about? Temperature, the basic parameters, which we've been monitoring for decades, for centuries now. Parameter which we feel, we sense. It's not like air quality that we don't know what the concentrations are. And we have no idea what are the indoor temperatures. So this shows that without really having data and understanding, we cannot make informed decisions. Optimistically, change is coming, the way I see it and the way has been mentioned in many presentations. So one of the studies in ESNT, the change in paradigm of air pollution monitoring, and here the focus is on low-cost sensors and big data to enable more information about air pollution. Or our study on application of real-time sensors for indoor measurements for buildings. So this is the technology we are talking about, but technology linked with the data. And here I'd like to bring a message which runs across the 3 articles in the Scientific American, which I started my presentation with. Smart cities, and we should add smart and meaning healthy cities, rely heavily on big data gathered from widespread sensor networks and advanced algorithms to quickly gain insights, draw conclusions, and make decisions on those data. Without data, we are just guessing, and we cannot make informed decisions. So talking about these sensors, low-cost sensors, wearable sensors. Basically every group in the world now which has anything to do with air quality is playing with sensors. Some consider them very good, others are still consider them as toys. And particularly if we see images like this, the pigeon flying over London with sensor on its back, or this bee, but this bee, it's not an air quality sensor, it's an location sensor. Sensors are as small as this on the palm of the hand. It is true that some of them are toys or less than toys, they don't do much, but there is a generation of sensors emerging which are showing very, very promising results. So once the data becomes available from these sensors, it could be really an eye-opener. Now, the example here is not eye-opener as such, it's just an example, coming back to temperature, of measurements, average measurements taken over a period of time in Brisbane in 2 houses. There's no pointer here, but if you can look, outdoor temperature is red, and as you can see during the day it increases reaching the peak. On both diagrams it is the same, reaching the peak in the middle of the day. The measurements were taken in Brisbane in winter, which is a bit cooler than it is here now, but it's not winter like European winter. Now, but if you look at the black curve, indoor temperature, as you can see in both houses, is completely different. What's the reason? Well, simple reason. The top house is non-heated and the bottom house is heated. So these are just 2 houses. But information like this, first of all, can be very important about exposure, energy consumption. We are talking so much about energy consumption, individual and community, and impact on heat island. Information for individuals about their houses and themselves, but also for designers, planners, city authorities, and so on. But the point, however, is that we need to start thinking about this in a completely different way. So it's not just one house or one system, the way researchers often think. We should think big data. So when thinking about one house, one physical system, it will not tell us much. But this will not one house will not give us much about thousands of other houses or entire city system. But data on thousands of houses from this information will emerge, which will help to change the world and safe as all. So there's no doubt in my mind that without good data and good data analytics, we cannot move far. Now, one little question is, are we interested in such information? And by we, I'm not talking about here authorities, politicians, and so on, because there's been lots of discussions, but we, even we in this room. Imagine that on your smartphone, you receive this kind of alert, air quality alert. You have just reached 75% of the WHO recommended maximum daily exposure limit. What are you going to do? Turn off the phone. Well, technology is progressing fast, but a lot has to be done. Rising awareness, teaching different behaviors, and role of social science. And it is not politicians, not authorities, but each individual has to understand. One amazing conclusion from one of the papers presented in one of the sessions on temperature and the mortality, it was in Portugal, people exposed to this, and the researcher asked the person why he suffered from this low temperature. Well, it's winter, so it should be low temperature. So in Portugal, so well, put a jumper. He's wearing a short sleeve. So it's complete lack of awareness to basic environmental risk. Without understanding this, we can't progress very far. And I'd like to finish linking to an excellent presentation of Yongguan and invite you to a dialogue on this. Now, you've talked about microbiome, and the term which I'd like to coin here is urbanome, which is genome of the city, which will include microbiome, but it will include all other biomes as well. Now, is it science fiction? If we can imagine this now, it's not science fiction anymore. It is going to happen. Thank you very much.